groups, right? We're officially being recorded, so the F-bombs will be kept to a minimum, which is one of the rules. Funny, or no, I'm joking. F-bomb minimums is not one of my rules. It should, maybe it should be. Okay. Who here feels very confident with their ability to public speak? Like, got it handled, like full on 300 style, like crushing it, not crushing it, kind of don't know. Where are we at? Okay. All right. Who wants to do next level public speaking, whether that be seminars or like events you're putting on for the public? Where are we at on that? Okay. Awesome. So what I kind of put together for you guys is concepts that I think span. I was thinking about what would the students of the NSEB be doing currently that we can build for, but also like where might you be heading? So these themes are kind of across the board, and honestly, they're mostly reflective and not something that I've ever sat there and like purposely put into practice prior to beginning. So like, I can't tell you I've had this figured out. I just kind of do it, and I've failed a lot of times, and I've gotten the crickets and the glazed over eyes plenty of times. And then there have been times when things have been really engaging and I've gotten really great feedback. So we'll kind of just dive in unless there's like a burning question before we begin. Okay, I don't know everybody, but like we don't have time for like the hi, how are you? Who are you? So I just would like to make a statement that I want to know all of you eventually. So let's chat offline for that. So why do I think, like, why am I here? That's the first question. Like, what the heck am I doing here? And I have a lot of different goals in my life. And one of them is to remove obstacles for people who have goals in their life that they are either on the way to accomplishing or unable to accomplish, or having troubles to accomplish their goals. So I look at myself as a resource. I look at myself as an advocate for the people I work with. This used to be patients. It actually all started with biochem tutoring. That's where it began. I mean, I guess I did like tutoring, teaching stuff when I was younger too, but like as a chiropractor, I got my start in biochem tutoring. So Part 1 boards, folks, let me know if you need a little help. I got you. But it started with patients after that, right? So like I'm advocating for my patients, I'm educating patients, and then, you know, not mid-career, because dear God, I hope I retire soon. So this is mid-career. Let's throw that out there, but I would never stop. So 7 years into practice, me and my husband decided to just uproot our whole lives and relocate closer to our families, because that was what was important to us at the time, which, by the way, takes a little self-reflection, which is part of what we're going to talk about today. And because of that, we got to shift our careers. And that shift was very painful, but also, what's the word I'm looking for? It was something that was very difficult to do, but it's been something that has allowed me to grow as a clinician, funny enough, as a speaker and an educator. I think that might be why I'm here. And also just as a human. And part of that was that, like, I was worried about missing patient care. And I was like, oh my gosh, I'm going to miss it so much. Guess what? I don't. And I mean, I love the challenge of patient care. And I'm also in an assessment class, which means I'm constantly assessing people. So I get patient care every day. But the other thing is I understood more about what my why was. And my why is helping people crush their goals. And so I still do that every single day. And that's part of what keeps me going, is that I get to encounter a student like Tristan who has amazing potential. And then I get to kind of just evaluate and see how they're doing. And then I interject what it is that I think she's needing from me. And then she asks specific things at the same time, and we do the whole thing. Okay. So I want you to know kind of the why behind what I'm presenting to you today is to hopefully help you identify things that may be holding you back that you can crush and push through, or also just outlining a little bit of a path that maybe you hadn't acknowledged or thought about as an option for you so far. So I have this broken down into kind of 3 categories of discussion. The first category is like the absolute tenets of things that you need, regardless of what type of event you're working with. Then there's some soft skills. That's the second category I want to get into. And then the third category is some random keys that I actually am going to bet that we talk about prior to me getting to that category. TBD. Okay. The most important thing, and I hope you kind of see what I did here, see what I did there, is central message clarity. And part of having central message clarity is starting with why. So I wanted you guys to know why I'm here. And it wasn't to lecture you on public speaking. That's the title that gets somebody that wants public speaking skills to show up, and it like maybe lights a fire, but that's not why I'm here. Because how many people could you learn public? You guys could just Google how to be a better public speaker, and you honestly would probably get better advice than I can give you. So why is it that we're here is like, this comes back to my core tenet, but also this is one of the skills you guys need to have is your ability to read a room and get a bit of a why from them. So you're going to be asked to speak for a variety of different reasons. And so you have to come back to why was it that you were asked to speak, right? And what is this group trying to accomplish as a unit that you are now officially playing a role in? And that is the beginning of your discussion, regardless of what your topic is. And this looks different depending on the situation. So just as an example, this is a situation where we aren't starting with a lot of discussion. It's kind of more so just me leading as we go. So I kind of define the why for us. We did that through asking a bit of a question, but also you guys getting a little backstory on like kind of things that drive me. But let's say we were doing a workshop, like I get you for 4 hours. If I get you for a long period of time, we are going one by one by one. And I am having you, we're not going to do the icebreaker stuff where it's like, Tristan, can you find a spirit animal that starts with the letter T? Or like random fun facts. No, you want to come hang out with me in a workshop, like with us, we're getting to the nitty gritty, husband, pun intended. We're getting down to what is it that brought you here today. So I want to know who you are, where you're from, why are you here today? What made you come to this workshop or this presentation or whatever? I want to know their whys before I begin. Because just like in patient care, which I hope you guys have had educators teach you in your schools, but I know you've been exposed to it in R2P, is that's what we do with our patients. That's what a history is for. I would argue that we don't need a history to diagnose. We need a history to establish goals and a history to establish rapport with our patients. Now, obviously, like we need it for diagnosis too, but like that first visit is me establishing the why. Okay. And that's what I want to give you guys as a recommendation of understanding. As you coming in is what is the central message that I need to be like imparting on these humans, but also what is the why as the collective. It's kind of like a two-sided comment. Okay. So who's familiar with Simon Sinek? I really hope you guys all are. So if you're not in an affirmative, you have a piece of homework for me. I'm an educator. Sorry, that's how it works. By the way, this was also patient care. You're always getting homework from me and my husband at Max Perform Chiro. Like rarely will you leave without homework. Your first piece of homework, if you haven't, is you need to watch the 20-minute TED Talk by Simon Sinek, Start With Why. Next level up, read the textbook, read the book that he wrote. But honestly, I feel personally that you can get the majority of the gist from the TED Talk. So 2 times speed your way through that puppy. And I feel like you're going to be better than you started. All right. Well, I actually got to work with a speaking coach because I was speaking for Parker seminars in Orlando. And I don't know how I ended up in Dr. Morgan's like list of people to share his speaking coach with, but I did. And I'm super, super grateful for it. But you guys, if like I have tons of notes, just like seminars, right? We take all these notes. Do we ever look at them again? Question mark. I know you know the deal. Like this is just kind of how it is. But here is the thing that I took away. Like we had all of these chats about structure and like I spoke with her a lot and we did all the like checking in with how many buts and ums and all of that stuff. But the biggest take home I had from that coaching was come back to your North Star, come back to your central message over and over and over again. And I think Addie, if this is our Addie, the Parker Addie here was the one in Orlando. Tristan, you weren't in Orlando? Were you in Orlando?
Yeah.
Do you remember my message for my talk?
I was moderating while you were talking.
Oh, that's why. Addie, put your mic on. Do you remember it? She's like, I would get put on the spot. We're all awkwardly waiting, Addie. Her mic's off.
Technical difficulties.
This is actually just a personal experiment right now. It's a rough day, huh, Seth? What is it? You can type it. We'll give Addie a second. But one of the things that the biggest thing I learned was coming back to that core message, because you guys, we understand our core messages so deeply that we live it, breathe it, talk it, walk it. But remember, you're trying to teach people about those fundamental principles that you live by, or you work by, or you practice by, and you're gonna need to repeat it over and over and over again. As an educator at Parker, if there's one thing that I really hate about teaching is the fact that I feel like I create such like spark in eyeballs. Like I get like people get excited, they get pumped up, and then I get feedback 3 trimesters later that no one remembers anything I taught them. And it's not because I'm a bad teacher, and it's not because they're bad students. It's because there's no reinforcement. They're not constantly practicing it. And so we got to take that on a micro scale to your workshops and your talks, that you're going to need to repeat it 10 times if you want people to take it away at all. Okay. And I was just wondering if Addie remembers it, because I probably said it 30 times in that talk. And that was actually the recommendation. And so my take home, which was almost an entire year ago, was people will do the movements that matter to them. So the exercise take homes that we have for our patients need to matter to the patient. So they'll do the movements if the movements matter to them. And so the whole talk was about how to relate people's movements and functional like discrepancies back to the things that matter and the motivations and psychological drivers they have. So central message clarity for yourself to know what you're coming in with, but then you need to reiterate that over and over and over. I actually hate that this one is on the list because it's the one I struggle with the most, and that is planning. Deep breaths. My best talks, when I'm feeling the best, when I walk away from an engagement of any kind, whether that be Chamber of Commerce, whether that be an R2P club that asked me to come and talk, or whether that be, you know, on a bigger stage, is if I don't have a plan, I end up sometimes accomplishing the goal, but like my percentage of accomplishing goal is so much better if I have a full plan going in. Like we need to have an outline. You need to know where you're headed. What are the goals that you're trying to accomplish? How much time do you need to talk about each thing? Like you got to plan that out. And if it's a talk that's really important, you actually have to do it multiple times yourself. And another comment from the speaking coach, 50 times going through a speech prior to giving it. I can't even fathom. First of all, I don't even know if I've ever written anything early enough to get 50 reps in. Like when would I have the time to get 50? The people who are the best have done it 50 plus times. Why do you think it's so easy for Brett Winchester to just off the cuff? because he's done it 50 plus times. Like he's done it so many times that it's so easy for him. And he knows if he has 50 minutes, he's got the plan already set. And as new presenters, it's difficult because that groundwork hasn't been done yet. And you have to put in the work. You have to grind to do it. And so that's hard, especially as a student. You have other responsibilities. Like it's hard for us to dedicate the time required. But one of the absolute core tenets of this discussion is you've got a plan. Third core component is truly understanding the content. You're going to stumble if you don't know it. So remember, we have like those levels of knowledge. So one level of knowledge is the ability to answer a test question off of it if it's A, B, C, D, or E. Another level of knowledge is being able to answer a test question if it's fill in the blank and you have 2 minutes. Another level of knowledge is, can you answer a question if I ask you one right here? Okay. The deeper we go, like I feel like I could describe the pelvis and rib cage coordination and stacking of intra-abdominal pressure to a 6-year-old. That's the level of knowledge we all need. Now, why would we ever be teaching a 6-year-old about that? It's not the point. We need to be able to meet our audience where they are in their knowledge of what we are presenting. You don't want to speak over them. You don't want to speak under them. But here's the thing, if you don't understand your content, you don't have those options. You're not flexible and you're not able to find that nice match where you're not getting glazed over, or you're actually engaging the humans you're educating. So you've got to be able to, you need to know your content forwards and backwards. And if you don't, that's where we start. And the heck with the plan. If you don't know what you're talking about, start there. You need to know the content first. And I know you felt it because we've all BS'd our way through a presentation before. Hands up, who's done that? Oh my God, I've done it way too many times. And part of it is like, you've got to try that a few times to know how uncomfortable it is. And then you leave and you're like, I'm an inauthentic a-hole. And like, we've got to make sure that we have ownership of the content we're presenting on. And part of that, especially like where I am now, is like you guys are in the constant learning ebb and flow. And it's really easy for someone like me to get a little comfy in my content and not continuously evolve and build it. And that's where like my best presentations now are the ones that I actually research again. Like, I don't know how many times I'm going to have to look at frontal plane stabilization strategies, but I need to do it again because that's what I'm speaking on. And I'll use my husband as an example. That man puts more hours into preparing for presentations than any human I've ever seen. Like not every night for 3 weeks prior to when it's due. So like, that's not even like, he doesn't prep the night before because that would internally injure him. But he spends so much time deep diving, and guys, like he's read McGill and Liebenson cover to cover probably 4 or 5 times each. I know he did like Rehab of the Spine 2nd edition and the low back disorders probably 5 times in chiro school, but he still reads it. He goes back, he reviews, he makes sure he's got the anatomy down, he makes sure he's got the physiology down. And then when he speaks on it, he knows what the heck he's talking about. And you can go off course if you already know. But the problem is if you don't know it, you don't have flexibility. You can't be creative and you can't bring that art to it. And I love the like philosophy, science, art stuff that like kind of gives this type of group the heebie-jeebies sometimes. But like, there's such an art to what we do, but our expression of the art is the fact that I get to just show up and play jazz. Like I know the fundamentals of music enough that I get to go to the jam sesh. Like, so now I know the fundamentals of what I'm teaching on so well that I can explain it 6 different ways, depending on the literal responses of my audience. Right. And I can sit there and go, that way didn't work for you all. Can I try that a different way? Let me try to explain it this way. And then we try again. And then they go, oh, and you're starting to see some nods and starting to see a little bit of like, they're getting into it and you go, cool, we've nailed it. the last core tenet, I think I kind of got into, see, this is where it goes, is like, there's no such thing as a list. The immersion of the content. So if you're speaking on the shoulder this weekend or next week at club, or if you've got an opportunity to do a seminar, whatever it might be, or you're going to the Chamber of Commerce to do a chat and it's on shoulder, your job now is to go look at Gestalt education and find the shoulder talks and listen to them. And you got to do a little bit of like immersion in the field of the content that you're about to talk on, because, and it's not that you're learning, like you already have the plan for your presentation. And I'm not sitting there going, okay, whatever Brett is going to say is going to be exactly what I talk about this week. No. Do you know what happens is when I get through a slide and I'm talking about XYZ, there's a moment that something pops into my brain. I go, I was listening to a podcast on this 3 days ago. And the way they explained it was something that was really cool. So I want to share that with you guys right now, if that's okay. And then you give a little bit of like, it's like that sprinkling of an added extra on top, and it gives you a little bit of realism, and it gives them another resource that they can dive into. And they're like, hey, that's kind of cool. Hey, and then they come up at, hey, what was that podcast you were talking about? And now you're like a viable member of our society of, professionals, where you're like interacting with each other, you're promoting people you believe in, and you're like expressing and explaining to people by your actions, you're invested in this as much as they are. Like, why would they be in your presentation if they're not having the same level of investment it takes for you to like immerse yourself in this content as you're kind of like making your way through that week? I think like the plan is the thing. Like you got to have a plan. And I laugh because like I would tell you 6 to 7 times out of 10, I don't have a plan. But at the same, like I'm better at flying at the seat of the pants now than I was a decade ago, but I would show up to a lot of Chamber of Commerce meetings, not ready for the chat. Or like I'd have a 10-minute presentation. I wouldn't prepare anything, and I would just show up, and like sometimes it was a total, like you just nail it. And sometimes it was a total dud. And I just tell you, like the times I was prepared were the just chance I had better chances. The other point is like just being okay with like understanding where you are right now with your content. Like sometimes it's like, hey, we're on the absolute beginning of this. So what I'm sharing with you today is just where we are today, but I see this evolving in the next couple of years so that almost everything I tell you is just baseline or rookie level. And we're going to know so much more in 3 years. Okay. Any questions before we roll through? We doing okay? Yeah.
I'd like to add something.
Hit it.
So I know that you're kind of dogging on yourself, saying that you don't have a plan a lot of the times. And like you and I have had a one-on-one meeting before, and I sent you an email like saying what I wanted to talk about. And then our conversation just kind of like went elsewhere. But something I think you did really well that I appreciated was afterwards you reached back out to me and you were like, hey, originally you said you wanted to talk about like this, like, do you feel that we accomplished that? And that helped me feel really seen. And like, I appreciated the conversation anyway, but I thought that was a really cool thing that you did by kind of like going back to the basis after we already did the deep dive. So.
That's awesome. Thank you. And that's a perfect example of like the inner struggle that I have, which I think you could just call me the tangent queen. And if you've ever sat in any of my labs, like it's just tangent city, but I do also feel a deep responsibility for accomplishing the goals. So I think you just saw the duality in that example, is like, I know what we need to do. And a lot of times, and this is what I tell, I sit in DIFDI labs and I'm a supportive faculty there. And it's so funny because I know what we need to accomplish. And I also know how much time it takes for us to accomplish that. And so I'll just kind of like take this road and we'll do we'll do a lot of that on the way. And I go, here's the deal. You will leave this lab with the skills required to pass every quiz and test that's on this content. But the way we get there is probably not going to be the way you think we're going to get there. But that at the beginning of the discussion kind of gives everybody kind of that tension ease where they know they're in good hands. I know what I'm doing, even though I'm going to talk about my kids for 5 minutes in the middle, but the story is actually related to what it is that you're all needing to take home today. But thank you, that makes my tangent queen self feel better. Okay. Let's talk about some soft skills. One of them is knowing yourself. Okay. So if you are on this path and you haven't started the self-exploration discussion yet, this is your moment to just acknowledge that you need to and start that discussion like after this meeting begins. Who here feels like you're on a bit of a self awareness journey as well, like learning yourself? I interact with a lot of Kairos students now. We actually did in practice as well. So we got to do coaching of students. We've been doing that for a decade now. And I find that one of the biggest things that I see as a barrier for you guys is right now you're in this like little bit of a different bubble and you have this like future life that is different than what you're doing now. And it's hard to learn the skills you're going to need for the new life while you're in the current life. And so there's this piece of what we all are doing that I recommend for you guys all to have. And it's understanding who you are at your absolute core, not who you are as a chiropractor. Like it doesn't matter to me. I don't care who you are as a chiropractor. I care who you are as a human. And then the coolest part is when you combine your skills as a chiropractor with who you are as a human, now you've got a marketable practice. And now I'm excited to hear about what you're presenting and what you're learning about recently and who you've been developing into. So that soft skill of actually understanding who you are, like the whole self-deprecating humor, which Tristan was picking up on, is part of speaking. And it's not that it's especially for those who potentially have a bit of like an ego battle where you sometimes come off with a bit too much ego, like having that having yourself reined in a little bit because you know you're like that is important for you to connect with the people that you're presenting to and to not come off in a way that you don't want to come off to the group of people that you're with. Now, sometimes when I'm like speaking with certain groups, I will purposefully show my true, like cleanest, no filter colors because I need them to know how passionately I feel about a topic. But it's not that I'm not going to be putting on a different face or changing my opinions in other groups. I just maybe won't focus on those emotions as much. So you have to kind of understand like, what are the strengths that I have that this group needs to be seeing? And then what are the things that maybe I need to just tone down a little bit to make sure that those connections are there. Okay. The second piece of that, which is partially related, is understanding who your audience is. And so I came into this meeting today. I have a feeling of what the NSEB already is. I got great prep from Tristan, but also I wanted to kind of get a feel for who's presenting, who feels good, who doesn't feel good. Like those questions at the beginning is kind of what I'm getting at for knowing your audience. That can be prior preparation. And sometimes you have to ask. Like my husband just got asked to speak for the Tennessee Chiropractic Association and his question list was pretty long. He's like, how long are you wanting me to speak? What kind of presentation are you looking for? Are you talking about lecture only or hands-on or combination? Who is going to be in the audience? What are the skills they're needing to come out of my presentation with? Because if we're not asking those questions, then what the heck are you doing there? You're just there to toot your horn and like, hey, look at all this cool stuff I've been up to. If that's what they want and they're like, hey, you're a badass and we just want to hear your stories, fine. You stand up and you tell your stories. But if they're like, hey, we're here, we want you to come teach us. Well, the first question I have, and this is actually to my detriment, I'll teach you whatever the heck you want to know. Like I can connect whatever you're needing to my skill set. And so it's funny because when we first started speaking for Parker seminars, the question was, what's your topic? And that's the worst question to ask a Dimak. What do you mean? What's my topic? What topic do you want me to talk on? I was like, I didn't know what to do with that. I had like full on anxiety for a month. I don't know, if I come up with the wrong topic, are you not going to accept it? Like, what is it that you're wanting from me? Why the heck did you ask me to speak was what I really wanted to email. But like, they're like, just, send over your topic. I'm like, this is not the way that this normally has gone. It's usually, hey, Dr. Dimak, can you come and speak on public speaking? Okay. Thank you for the information. But if you're not given that information, you can totally miss the point. Right? If you don't have an understanding of who the audience is. Sometimes we need that prior, sometimes you're going to get it live, but you got to be ready if you're getting it live to do some course correction, which brings me to my next soft skill, which is I like to call it clinical chameleon, but we're going to connect this to speaking. So one of the things I talk a lot about is becoming a clinical chameleon. And some of you, what I don't want you to do here is misunderstand this as being inauthentic. What I want you to take away from this is I can be whatever clinician you need me to be today. Okay. Now that could be a hands-on soft tissue therapeutic focused doctor. It could be a manipulation focused doctor. It can be an exercise focused doctor. It can be a biopsychosocial focused doctor. It could be a doctor who only educates and does no technical treatment. Do you see like kind of what I'm getting at there? I don't know what the patients who are coming into my office are needing until they're in my office and telling me what they're needing. Okay. Now, sometimes you have like rapport and you understand like over a couple of visits, who's coming in and what they're going to need from you. But that ability to be a clinical chameleon and have tools in your toolbox and back to the core focus, the understanding of your content enough to be flexible and creative. That's the fun. Like I'm ready. Like, are we going to, I don't know. Am I going to adjust anybody today? Will the piezoforms be removed from their holsters? Like, or am I going to get my reflex locomotion on that I haven't done in a minute? I don't know. That's the best part. And so that's where like, I need you guys to be ready to be a speaking chameleon, right? You need to be ready to evolve, ebb and flow live. And that's a long-term skill. I don't know how long it takes to develop these things. Some people just have it. Those of us who don't have it have to work for it. There's just a level to it, but you need to be ready to be flexible. But your core value needs to always be expressed. You're not allowed to compromise your core values as a human and as a professional, if the presentation is in a professional environment, to be able to fit the community. And if we can get ahead of these things, like if I'm being asked to speak at a vitalistic conference, it's probably not a great fit. And it's not that I don't think I could create value for that group of people. But maybe the question is like, let's bring a, rehab active care focused clinician into this and bring their opinion on fill in the blank. Like, actually, maybe I'd be down for that. But if they're having me come in for a typical conversation, it's just not a good fit. And so we got to just not do those types of things. But, so that core value needs to be able to be expressed. And this is one of those things where, when it comes down to choosing what you're doing, I'm going to go rogue for a second. This is going off the list. You guys are right with that? You all right? We okay on time? Maybe another 5 or so minutes, and then we can do some discussion. Okay. All right, Johnny. Okay. So most Johns I've met either love that or absolutely hate it. So it's like, okay. All right, cool. And it's okay for you to do this and then I never do it again, I promise. Okay. This is something you guys need to be doing with your schedules, and we can apply this to like speaking opportunities, but I look at it as schedule management. To me, this is something that ends up on my schedule, right? So like whether or not I said yes when Tristan asked me comes back to the theme I'm going to present to you. So it has to do with like what you're consistently being asked to do, or whether or not you say yes or no to like more random or sporadic opportunities. And we so I've been Marie Kondoing this before Marie Kondo was Marie Kondo, but I'll give her all the credit now, because this is what you're going to do with every opportunity that comes into your life. You're going to put it in your little hands right here. And we're going to go full woo. We're going full woo. And you're going to say, does this bring me happiness? Like, does this spark joy? Like, you can use her terms, but to me, does it make me happy? Yes or no? And you got to answer. There's no like, well, no, it's either it makes me happy or it doesn't. So you guys as leaders in R2P, as you're starting to get that burnt out phase, whether it's because of R2P or school or practice or whatever it is, once we get close to that, we're going to have a discussion. And it's, does this make you happy? Yes or no? Okay. Ready for the second question? This is full rogue, has nothing to do with the presentation, but we're going for it anyways. Second question, does it bring me closer to my goals? Because we have to manage both, don't we? And then the last question is it worth continuing? Or it's continue as is, needs change, drop. Those are the choices. Go, change it, drop it. All right. So we get to do that as things come into our life, but also with the things that are already in our life. You can do this for humans, tough relationship discussions. You can also do this with friends. You can do this with professional collaborators and marketing partners, but you can also do it with like opportunities and things that you are involved in. So make sure that when you're choosing to do speaking things in the future, that it like needs to make you happy. Otherwise it's not worth it, unless it's making you so much money. And right now the goal is saving money, right? We do stuff that doesn't make us happy because it brings us closer to our goals sometimes. That's part of life. But it has to, like, you have to be weighing these things, and it's okay to have a conversation. And one of the examples that I'll give you guys is I stopped teaching group fitness classes because of a conversation just like this. It was not making me happy anymore. Okay. It was not making me happy. And at that point, I had already kind of maxed out that market. Like everybody who was going to any of the places I was teaching was already a patient of mine. So it really wasn't bringing us closer to our goals anymore. So I decided to drop it. But I did that before it ended up creating resentment and all like this bad attitude stuff. Like I left on really good terms because I had a bit of foresight with it. Okay. Back to the farm. Here we go. A few more comments and let's get some questions rolling. Confidence is the other soft skill. I had a great comment given to me by a student that I value very heavily. And it was a moment that I've been talking about. And it was such a great moment for me. So this person shared with me, hey, when I went into clinic, I was feeling really good. And now I feel like I don't know anything. And I was like, Dimak, why are you clapping? Why are you happy? And I'm like, hi, you have just found yourself on the Dunning-Kruger effect timeline. So here's that Dunning-Kruger effect, right? Like that unconscious incompetence is up here and you have all that confidence that you shouldn't have. And then you come down to the absolute depths and you feel like you should have probably picked a different career. And then the path to mastery looks like that from there. Okay. So like this student was catching me right here on the way down from that like exciting, inappropriate confidence. And like, here's me over here, like barely above, but like on the path to mastery, just a little further, 10 years further. And like, hey, it might actually get worse from here. Like you might actually feel less ready than you are right now in the next year or so. And that's okay. Because the win here is awareness. It's the fact that your unconscious incompetence turned to conscious incompetence. And we celebrate these things, right? This is the moment you get to like face palm with me when the Try2 tells me how they're going to practice chiropractic. That's fun for me to laugh at, sometimes to their face and sometimes to the student who also saw it as a learning opportunity for them, right? That's like the confidence level is sometimes confident in your level of incompetence. That's okay. It's okay. You show up and you go, hey guys, I'm just grateful for this opportunity to share some thoughts with you today. Thank you for having me. I'm honored for the opportunity to speak, but I gotta tell you the truth. And maybe I should have told this to the person who asked me to speak today. I don't know anything. I don't know anything yet. But here I am on my journey to learning, and I'm going to share some things that I've learned recently with you in the hopes that they can help inform where you are on your journey. And you just own it, and you just own it. And it's this weird thing that I'm way more comfortable with now than I was when I was in your shoes. Because like, if I was like, oh my God, me and Try 7 in Cairo school, I would have never let anyone know that I didn't know what I was doing. No possible way. I was the Gold Star Achiever Award. Like, give me all of the, I was the top of everything because I had to be. That was the only option. But like, I was faking it. I had no confidence. It was all pretend. It worked out okay for me, but I just want you guys to know that it's okay to acknowledge where you're at on the scheme of things, and just acknowledge that to the people you're presenting to. I think that authenticity and humility goes a long way. And I've gotten a lot of feedback on that especially as a teacher. I think that I make it clear that I know a lot of things. I drink and I know things. I got a little Isaac like sass there. There was a little Isaac sass with the look there. Are we not a Game of Thrones fan? Did I read the room incorrectly?
No, I love Game of Thrones.
Okay.
I understood it quickly.
Perfect. Okay. I just see, it's me learning my audience. I've gotten a lot of feedback about that from people I value, that they like the fact that I share with them my failures, because I think that that's important, because I don't think you guys see enough people fail. You don't. You think the gurus are crushing it. And I'll call out my friends, the beards, who have been in this game almost as long as me. I got like this much on them, like a couple trimesters worth. I know you see their failures, but you also watch them handle their failures like champs, right? Like, they take it in stride. They don't let it get to them. Sometimes they do, and sometimes it takes a while to get back from it. But like, you sometimes, and I'm not saying that Bo or Sloan is out there pretending they don't fail, but there are a lot of people who are out there pretending that they don't fail. And it gives you guys the wrong idea of what it looks like to be successful in our craft. And part of being successful in our craft is absolute full-on face palming every single day. Like, just, what am I thinking level stuff. Okay, I'm going over a bit. I wanted to talk about one thing really, really fast before we go on, and it's myth busting. So those were the soft skills, and we went through them. If you guys want the list later, I'll share them with you, because I did have a plan. There's first time for everything. I am very used to coming to a community that has a lot of misinformation and helping them navigate that misinformation. My example is, I've led a lot of workshops at yoga teacher trainings for yoga teachers. And the specific comment I'll bring out, which there was a lot of them, but the biggest one was the navel towards spine discussion. Okay. So when you come into a yoga community with the knowledge to dispute and totally bust the entire, like, something that they hold so important and something that they put so much emphasis on, there's a really good opportunity for you guys to not make friends and not get invited back. Okay. So I just want you guys, like, I'm going to give you some keys to how to navigate, like, getting ahead of controversy and starting hard conversations. And there's two ways you need to do it. The first thing is, you need to establish the lens you're coming from. So you define your lens. So say, hey guys, I'm here today as a fellow lover of yoga, but also as a chiropractor who has spent the last X amount of years, or if you're brand new, just said a lot of time, just say a lot of time. But now I get to use the word decade, so I use it a lot. So someday you can say decade too. But now I've spent the better half of the last decade on a journey to figure out how to best and most optimally utilize our cores. And so I'm establishing where I'm coming from. And then I go, some of the things that I'm going to share with you today are a little bit more clinical focused and not as applicable to your everyday teaching, but it's stuff I think you need to know, because it should and potentially could help inform some of the ways that you communicate with your students. Okay. So like, it's not me saying you're wrong. I'm establishing why you need to listen to me first. Okay. So it's like the Trojan horse level, like, I'm in here and I'm here. So now when I'm in the group of students who I already know are not interested at all in learning about rehabilitation and would prefer to just, Paisafarm their way through life and call it a day. And I walk into this situation, I go, look, I am coming from a place of love and learning. Like, I love you all as fellow humans. And as long as you ethically treat your patients, then we never have a problem. Like, I don't have any problem with how you choose to practice chiropractic, as long as you are ethically treating the humans that interact with you every single day. As long as that box is checked, we're good. But also, I understand that there's a place that you need to get to that I don't think you're there, even though you think you might be there. And so I am here to push you, and I'm here to help you learn and help you to improve. And so I need them to know that I'm about to myth bust some of the things that they've been hearing, but I'm not doing it because I just like to, show my stuff. I'm doing it because I need you to be a better doctor. Okay. I'm teaching the yoga class about functionality of the core because I need them to be better teachers. Right? That's what you hired me for. That's why you're literally here. That's why it was 2 years ago now, students pay me an $80 each a lab to teach them for 2 hours. I do not see any of that money, but that is what they pay Parker, or that's what they paid Parker in 2020 when I asked, because I was there, people weren't coming to lab. And so I was like, I want them to know how many dollars they're throwing in the trash can. So I figured it out, and it was 80. I'm sure tuition has gone up. Okay. So first and foremost, if you're going to start hard conversations, you have to establish rapport, trustability, understanding. Like, I'm humble. I'm not telling you that my way is the best way, but I am here to tell you that I know a lot about this, and I want to stimulate conversation with you guys. And then the second is you need to address the roots of the myth. I know why we use this term. Guess what? There were some studies done with Paul Hodges back in the 90s about transverse abdominis. Funny thing. What that showed is that people with no back pain had transverse abdominis activity prior to their engaging exercise or their lift, but people with back pain had it delayed. So one of the cool things about evidence is we learn something from that, but a bad thing about evidence is sometimes we extrapolate and take it too far. And so where this cue has come from is because we think we need to activate transverse abdominis prior to engaging in activity, because people with no back pain do that. And then I go into the fact that McGill has essentially established that we cannot isolate transverse abdominis. And then I talked to him about the other rule, which I guess should put on the list, is, poor planning. I never take something off the table without replacing it. You are not allowed to say no if you don't have a substitute. You can't just say, don't say that. It's, hey. We're not going to say navel towards spine at Maximum Performance Chiropractic. Here's why. That cue is an isolated core focus, when we actually know that the core functions its best when we engage the entire abdominal wall. So what we're going to do instead is we're going to cue them into, first and foremost, getting them into a stacked position with the rib cage directly over the pelvis. And then we're going to cue them into an appropriate amount of intra-abdominal pressure, that whatever they're needing it for, or appropriate to whatever they're needing it for. So it's dispel the myth by understanding why the myth is there. And if you don't understand why the myth is there, then maybe you shouldn't be dispelling it. And sometimes the answer is like shitty Instagram influencers, and that's okay, but have a little bit to back it up if you don't mind. Okay. That's what I got. And in those discussions, focus on facts and not feelings. This is like a relationship tip. If you want to be better as a human in your relationships, whether that be doctor-patient relationships or spouse relationships or friend relationships, is we always want to focus on facts and not feelings, right? Like, I want to bring these back down to the facts, because I don't know about you guys, but I'm a really emotional person. And so when I get too caught up in how I'm feeling about something, I totally disconnect from reality. And then I end up complaining or, going on soapboxes about things that are a little bit off topic. Whereas instead I like to focus on the facts. And then I find that we can do better in dispelling some of these discussions. Okay. I think I've talked enough about talking. So do you guys have questions for me? Like, do we see any additional barriers that we need to bust through? Any questions about what we've talked about?
I think one good point you make, and that I know I've talked to at least with like the Logan crew when I was there, is captivating an audience, but a mixed audience. One thing that's really interesting with how R2P clubs are run is you have, at least Logan, every trimester, every 4 months, you have new people cycling in. And then you get to a point where try 4, 5, 6, you have that Dunning-Kruger effect. A lot of those people are like, I've seen everything R2P has to offer. I don't need to practice anything, DNS, neurodynamics, whatever, any like model again. I got it, I'm good. So it's like, how do you find a mixed crowd? How do you teach two groups almost at the same time?
So there's two approaches. And you're like, here's the two sides of the spectrum. Okay. So the first is trusting the higher level group and their ability to understand that they're going to get clinical pearls out of listening to you speak, regardless of if it's a topic they've heard before. And I actually talked about this in my lecture this morning, and I made a comment. I said, I've probably gone to and or listened to Craig Liebenson talk at least 50 times. And I always go to Pocahontas because I like Disney references. And in Pocahontas, she talks about how you can't step in the same river twice, right? So just like the rivers, we as doctors are never the same doctor twice. And you guys, like students or future doctors, you know, depending on your state licensure, we got to be careful with what we say. But you're never the same vessel twice, right? So like you sharing about shoulder impingement when I was try 4 versus me learning from you about shoulder impingement when I was try 8, like I need to have a mind that's open to the fact that I'm going to learn something new from you, even if I've heard this topic before. Okay. So part of that learner's mindset needs to be ingrained throughout it's like an underlying curriculum. Okay. So your older students need to have a bit of that theme there, where maybe you look around the room and you go, hey, my older students who are here, here's the thing. I know you guys have heard about shoulder impingement today, but I have a feeling that there might be a few things that I can offer to your paradigm that either enhance what you're already doing or are opportunities if what you're doing isn't working and you're looking for other options. So maybe coming from a place of diversifying their toolbox, or enhancing a toolbox that's already present would be kind of one like way to address. And again, you can kind of integrate multiples of these. Now, as we look to like the younger students, because one of the things is, and I don't like, I really don't like the term dumb it down. I don't think that's appropriate, but I think that like whenever we have like practicals and things, I always say play patient is like, don't play dumb, but you're going to play the patient. But as you get into the lower levels of knowledge, you have a choice, and it's either you speak to them and make everything connected to their level of understanding, or you go just above, like you give them a little bit of the basics to be able to connect what you're presenting with something they know. But this is like the carrot, like you got to dangle the carrot a little bit. Like you got to make it a little unreachable that they recognize their deficit. So like one of my goals in a Tri-6 environment is to establish where their holes in their knowledge are. But you have to do it well. You can't do it with an ego and be like, I'm a Tri-9 and I know everything. And here's where you suck at life. Like that, we can't have that conversation. But you go, hey, when I was a Tri-1 and the first time I heard this, my mind was blown. So I hope I do a little bit better at connecting the dots for you today than when I was learning this as a Tri-1. And so, but again, like you want the holes, like you want them to feel like embrace the suck. They need to feel a bit inept, but give them enough knowledge to empower them. Okay. It's a little salesy, and it's a little bit what we do with our patients. Like our patients need to know what they could do for themselves, but they also need to know why they need you. That was a long answer. Did I touch on any of it? Do I need to send an email after and check if we've met the objectives? I might. Sean's getting an email.
I'm ready for it. No,
Cool.
That was good. I think that's something that all the clubs are kind of dealing with, is just there's a constant rotation. So trying to figure out how to best tackle that is helpful.
Yeah. And that's where, but there is a way to do it poorly. You can't shotgun it. You can't give level A, level B, level C, because then it's too much. It's just overwhelming. And so even for people who understand it, it's overwhelming. So what is the core, like here, okay, what's your clarity on your central message? What is it that you need everybody walking out with today? And how does that learning objective apply to a try 1? And how does that learning objective apply to a try 8? So maybe a deeper dive on what it is you're presenting and like, what's the central focus, and then letting the art come out a little bit depending on the room. This also requires way more planning than I almost give anything, but we can put it out there as ideal. All right, what other questions?
What are some of the most common mistakes you see in R2P presentations that you think that we could improve upon?
I see a lot of them, don't I? Not explaining what you're doing and why. Right? Like, you got to recognize that. So again, there's a reason to dangle the carrot. But if you're choosing to do an intervention and you haven't explained the why behind it, then I don't even know if you know what you're doing. You know, like, I don't know if we're at that point while we're in school where I just like blindly trust the understanding of the content enough to know you know what you're doing. So as your like, I'm not the official advisor, but as one of you guys as mentors, I want to see you guys break it out, because that's your challenge. Because like, I just want you to think about, like, if you're a try 10 or try 9 and you have a bunch of patients and you just come to club one day and you just show how you do stuff, like, that's great, but that's just, you just playing. Do you have the self-awareness and ability to like filter out the tenets of what you're actually doing when you're working with a patient to teach it to somebody else? Or are you just demoing? Like, do you remember how long it takes me to demo a case in a lab? 2 hours. Have I ever spent 2 hours with a regular patient? Absolutely not. Could I demo it in 15 minutes? Yes. Would anyone in the room know what I'm doing? Maybe my husband, probably you, Tristan. You know, Addie's up there. She's going to keep up with me for the majority, but like, that's not the norm. So your value as an educator comes to your ability to find the underlying path and teach that. So this comes back to like functional assessment a bit. Like in the class I teach you guys, it is like a dip of the toes. 0, like, you do not get enough to be good at almost anything. But what I promise at the beginning of the course is a framework to build off of. So can you, to kind of come back to your question, whatever it is that you're teaching, if you're not giving someone that baseline framework, even if it's just like at a quick aside, like, hey guys, we're doing this one because we want a little eccentric loading of the posterior cuff musculature. Boom, back to it. Like, just a quick pause. Do you know why you're doing what you're doing? And can your audience follow why you're doing what you're doing? That's one of the things. And so you guys kind of get caught up in your process and you're not explaining those pieces. And the other one is overloading. It's too much. Too many interventions, too many progressions and regressions. Stick with a couple, hit the good ones. And if you feel like there's not enough time, like if you want to do more, pull it into 2 meetings. Revisit lower quarter frontal plane. How, like, could we ever get enough lower quarter frontal plane? If anyone in this group thinks you've had enough examples of lower quarter frontal plane, anything, welcome back to the Dunning-Kruger line, right? Like, there's just, I don't know if there's enough of some of the topics that we cover. So split it up. Also, I had a message for you guys. I usually put a message on the board. So it says shine bright like a diamond, Isaac. And I'm talking to you. Did that answer your question, Tristan?
Yes, ma'am. Thank you.
Cool. What else, guys?
You talked about the confidence scale. When do you ever feel like you're kind of coming up? I'm just curious.
I don't. Um,
Okay, good.
no, I think you're doing it wrong if you feel like you're significantly there. I feel like we all have like our internal pendulum there where like some parts of the year I'm arguably feeling a little bit overconfident, and then some parts of the year I'm feeling way too insecure. You know, like I feel like we all have like a bit of a micro scale that's happening along our scale. So like, and I know you guys have seen this in mentors of yours, that you've seen them, like sometimes they come off a little like full of themselves, and then sometimes they're just not on their game. Like we all have that ebb and flow. But I think the biggest change for me in the last 2 years is the fact that I'm good with where I'm at. Like I understand my limitations enough that I'm just okay with the fact that I don't know everything. And if you saw like the activities of my professional life, like you'll also see me refer out more. Like I think that I had to be everything and do everything and be the one for everything. And like I've learned how to just acknowledge that, like, for example, I don't want to do sideline care. I also don't want to present on it. And I don't want to be the go-to at Parker for sideline, like quote, sports chiropractic. It's just not interesting to me. And that's just okay. It's okay to let someone else who has those skills be the star in that arena. And so it's a bit of that, like, internal, here's what you'll see before you feel confident or like feel like you're really in it. The first step is that internal personal security. Is like, you need to feel safe, right? So like, you guys know, like the Maslow's hierarchy of needs. Maslow, I think it's Maslow. Second homework assignment.
It's Maslow. Sorry.
Maslow. You would, Tyler.
I would. I'm sorry. I'm so sorry.
Also, I appreciated your Isaac Sass comment, so thank you. So the hierarchy of needs, like you have to look at this stuff. So we have to understand why we're being insecure, right? So like that's the internal reflection piece, is like, am I insecure because of my actual clinical skills, or am I insecure because I only have a contract that goes a year? Am I insecure because my family life's a little rough? Am I insecure because we're not paying our bills on time? Like where's this coming from? And so sometimes that's therapy. Like you're going to need some therapy to help you. But the other piece is I think it's just finding that comfort with who you are, like in your own clinical or professional skin. And I'm just okay with what I have to bring to the table now. And I'm constantly going to evolve, and I'm not going to stop improving and getting better every day. But I also don't feel this like heat on me to be the absolute best every minute, like I did when I was in your shoes. And I think that's a personal thing. Like I have become more secure as a human. That's, I think, where that comes from. And it has nothing to do with my knowledge and skills.
Appreciate it.
You got
It was
it.
just, I guess we always talk about like in club and like what you're taught. And it's just like, we always, I guess, focus on like the straightforward, right? Someone comes in with a shoulder complaint. This is like our shoulder versus like, you know, like you see like the paperwork and you're like, okay, perfect. They've got knee pain. You see the age and you're like, I have an idea of what this is. And they come in, they're like, yeah, my patella dislocates. And you're like, all right, that's where we're going today. So it's just like, I don't know if there's ever like, yeah, I don't know. I never feel like I walk in there. Like I walk in there with confidence, and then it's just like, they literally tell me their subjective complaint, like the intro line on the EHR system. And it's like, I'm already typing that being like, I have no clue where this is even headed.
Perfect. Yeah. So here, I have a bit of a twofold other answer for you here. This is where your knowledge of biomechanics needs to evolve. So like, I'm not sure that you could bring me a knee complaint that I wouldn't be able to figure out at least one level of what's going on, because I understand the knee so well. Like I know that menisci won't really hurt at the superior patella, right? Like that's not where that's going to hurt. Off the list. Like it's not even worth me doing Thessaly's exam anymore because I don't need to look. It's not that. And that's where like there's there's two ways to train it, and it's deep diving into the anatomy and biomechanical knowledge and understanding joints and joint mechanics so well that you are just untouchable there. And the other piece is seeing enough knee pain cases to establish your comfort level. And I think it's comfort, not confidence. It's comfort. And you're just not comfortable because you haven't seen it go this way, that direction as much yet. You're on the path, you'll get there. The other part is that it kind of the same answer is you could not have, like, you're just not ready to play jazz yet. You're still learning music, and that's okay. Right? So like, I get excited by the same thing that you're frustrated with. And that's the difference between you and I now, is like, that is exactly why I would be waking up and going to clinic, is because I have no freaking clue where that chief complaint's going, and I'm ready for whatever it takes. But here's the thing, I have the ability to look a human in the eyeballs right now and tell them, hey, we really didn't figure anything out today. Like, we are not there. Not the first time I've been in this position. Here's what we're going to do. And I still have the ability to rein it in and have control and understand where we need to go. Because I've just floundered there. I've failed and face planted enough times that I feel comfortable there now. So you haven't seen the variations of the norm enough to feel comfortable riding that wave through a visit. Like, you're just, you just got on the surfboard and you're learning, and I'm not Laird Hamilton yet, but like, I'll go to the quote. This is exactly where I feel like I am. So in the book, You Are a Badass, third homework assignment. See you, Sean. Third homework assignment. The recording may end. So see ya. Third homework assignment, You Are a Badass. Must read. Okay. One of the things about the recommendations that Jen Sincero, the author of that book, gives is, if you have a goal, and there are humans out there who have this goal, or you need to go find the people who are kicking ass at what you want to kick ass at, or, and this is where I personally define myself, is they have their foot in the air on the way to do so. Okay. So like, so you're at the beginning, like you're kicking, like you're at toe off to the kicking of the ass on the end of swing phase. You're a runner, so you like gait, right? Okay. I thought, know your audience. You're starting the journey, and I'm like halfway through swing phase, but like, I'm kicking ass, but not right this minute. I wouldn't say I'm there, but I'm in the process. Okay. And it's just okay to be in the process of accomplishing it. You're just at the beginning. You got this. That's okay. Let me just tell you this. Sometimes we just got to look around the room, and I will tell you, I would rather be in your stance phase than a lot of the people at your same level stance phase. Okay. Other questions?
Thank you.
Y'all are standing up. Isaac is face down on the ground. Oh, sorry. This isn't after the R2P Symposium Social.
Before we
That wasn't an actual comment. It's just, okay.
Before we wrap up, I just wanted to say thank you, Dr. Dimak. The beginning, when you introduced yourself, you said that you're an advocate for others, and I have witnessed it on many occasions. You constantly pour yourself into Parker, Rehab to Performance, and other students to help us grow as future clinicians, but also just as better human beings. So I wanted to say thank you. And I know there's only 10 of us left here, but I think I learned a lot that I can carry over to multiple aspects of life. So thank you.
Well, guys, thanks for having me. I know we went a little longer than planned, but the plan, please know that like, I'm here for all of you, and that's not like, you don't have to come to a meeting like this. So reach out social media. If you want my contact info and you don't have it, you can always reach out to Tristan. Just, I'm here for you guys if you're struggling, or if you just need a little excitement or want to dive deep into something. I'm more than willing to help you out. So don't hesitate to ask. And thanks again for having me. I'll jump off so you guys can finish if you have stuff to do.